Restart it. We had just did it.
Okay.
Alright, ladies, we're here to talk today about a hysterectomy. A hysterectomy, it is the removal of your uterus, which is where babies are created, and after you have a hysterectomy, you will no longer be able to reproduce or have a menstrual cycle. During surgery, they can remove up to 3 things: your fallopian tubes, your ovaries, and your cervix. There are 3 types of hysterectomies. There is a subtotal, which only removes the upper part of your uterus. A total, which removes the whole uterus and the cervix. And the radical, which removes the uterus along with the tissue on both sides of the cervix.
Can you please explain what the partial, subtotal, and the partial hysterectomy does?
Yes, it removes just the upper part of your uterus.
And can you please explain what the total does again?
Yes, the total removes the uterus and the cervix.
And the radical, please.
The radical removes the uterus along with the tissue around the cervix and the top of the vagina.
Okay, please go on.
Alright, the surgical procedures, one is an abdominal hysterectomy, and it creates a 5 to 7 inch opening and you can go in horizontal or vertical on your stomach. It's just above the pubic hairline. Another procedure is where they use 3 different instruments to go in, and one of them is a camera to guide the doctor on which ovaries to pull out. And the last option for a hysterectomy is the vaginal hysterectomy, and that is when the doctor will remove the uterus through the vagina with a camera to guide the procedure.
I'm sorry, I think I may have confused the 2 last options. Can you explain to me the difference between the second and the third option?
Yes, the second option is where they go in through incisions, and they use 3 different instruments, one being a camera to guide the procedure. And the third one is when they go in through the vagina. There's no incisions on your belly or anything like that. They just go in and pull out your uterus. Oftentimes there is a robotic assistance, which means they just use a machine to assist with the incisions, and they do this mostly with cancer or overweight patients. There are many reasons to get a hysterectomy, but a few are cancer of the uterus, so there could be cervical cancer, ovarian cancer, and then fibroids, which are non-cancerous tumors, and then abnormal vaginal bleeding, which is change in your hormone levels. So the risks for having a hysterectomy are blood clots, there can be pain during sex, and also lead to early menopause, and any other risk associated with a surgery. And after getting a hysterectomy, you still need to go get your regular pap smears and your annual mammograms. And it's very important to get mammograms and pap smears if you had a hysterectomy for the reason of cancer.
What is it important to have, a pap smear or a mammogram?
Yes,
Both.
both. Annually.